Amlodipine is an anti-hypertensive medication that works by blocking the calcium channels in the blood vessels to dilate them and reduce the blood pressure. And here we will talk about the contraindications for this medication. So starting with the first contraindication, and that is the hypersensitivity reactions, which are the allergic reactions to the amlodipine. Now, allergic reactions is an absolute contraindication of the amlodipine, and examples of allergic reactions include skin rash, itching, hives, angioedema, and Stevens-Johnson syndrome. Now regarding the second contraindication, and that is the unstable angina, the STEMI, and the NSTEMI myocardial infarctions. Now, in myocardial infarctions and unstable angina, there is ischemia to the heart muscle, and amlodipine leads to vasodilatation, leading to reduction in blood pressure, and the heart will try to compensate for that by reflex tachycardia. And reflex tachycardia would require the heart to work harder, meaning it needs more blood flow to the heart. And since in myocardial infarctions and unstable angina we have myocardial ischemia, meaning the amlodipine would aggravate this ischemia by stressing the heart, leading to more blood flow requirement. And amlodipine is a relative contraindication in these conditions. Now regarding the third contraindication of the amlodipine, and that is the severe hypotension, and this is another relative contraindication. And the theory behind that is that we already have hypotension, and the amlodipine would furtherly cause more hypotension, leading to vital organ hypoperfusion and syncope. Now moving on to the fourth contraindication, and that is the cardiogenic shock. And cardiogenic shock is also a relative contraindication. And in cardiogenic shock, the heart cannot pump the blood effectively, and this is exacerbated by the vasodilatation caused by the amlodipine. Because vasodilatation means more blood flow required, and this means more stress on the heart, which is already in shock. Now regarding the fifth contraindication of the amlodipine, and that is the severe aortic stenosis. Now this is also a relative contraindication, and in severe aortic stenosis, the left ventricle is already exhausted from pumping the blood through the stenosed aortic valve. And remember, the amlodipine causes vasodilatation, meaning more blood is required to go through the stenosed aortic valve, and that means more work is required from the left ventricle to make the blood pass the stenosed aortic valve. And this may lead to ventricular collapse and dysfunction. And with that, we reach the end. Please give us a like.